Let us talk about frozen shoulder. Frozen shoulder is a condition where your shoulder joint is almost freezed and your movement at the shoulder joint is restricted. Now let me tell you why this is happening. Shoulder joint is a big joint and it has lots of muscles that bring stability to the joint, and these joints are helping you, these muscles are helping you in movement. Now some movements like taking your hand above, putting your hand at the back, doing combing, buttoning, unbuttoning of dresses are all happening because of the movements in the shoulder joint. Now if you have realized that few movements, especially like combing your hair becomes difficult, buttoning, unbuttoning your dress becomes difficult, or while bathing if cleaning at the back becomes difficult, then it may be a start of frozen shoulder. So what is frozen shoulder? Frozen shoulder is a degenerative condition, maybe because of certain medical conditions like uncontrolled diabetes or uncontrolled thyroid issues, rheumatoid arthritis, or can happen because of any kind of injury. So any injury which would have led to rotator cuff muscle injury, muscle tear, would eventually lead to frozen shoulder, where you will have pain in the shoulder, stiffness in the shoulder, restricted movement, and in later stages there will be a time where you could not even lift 10% of your joint. So this frozen shoulder can be very well taken care of if you go and see your physician at the earliest. Now when you come to the physician, we take your history, we talk to you and identify which movements are difficult. Then we do certain tests. Those are active test and passive test. Active test is when we ask the patients to do, and passive is when we doctors do it for the patient. Then if required, we do an ultrasound scan. And in ultrasound scan, that's a dynamic scan where we can find out if there is any degenerated cartilage, if the rotator cuff muscles are good, if there is any tear, if there is any fluid, if there is labrum tear, and what is the status of all the muscles around the joint, if there is any inflamed bursa. So everything once we have identified, then we'll give you a proper treatment. What is the best treatment for frozen shoulder? The best treatment for frozen shoulder is prolotherapy, or it could be platelet-rich plasma therapy, or it could be a glenohumeral joint dissection. These are minimally invasive procedures which are done with the help of small needle, and we do it under ultrasound guidance. What we do here is, when your joint is now freezed, that is both the bones are touching and the movement is restricted, we try to create a space and we break the adhesions with the help of these injections, which can be done very easily in 10 to 15 minutes under ultrasound guidance. And after that, we put you on certain exercises for your shoulder mobility and for your shoulder stability. So frozen shoulder can be treated permanently with the best result. You don't need to suffer with frozen shoulder. So if you're suffering with it, do follow our page and get back to us.